For those of us who are turning 65, along with being 65, you get to transition over to Medicare for insurance. And I'm going to read some stuff to you because a lot of this stuff is new to me. Ever since last year, I've been getting all type of pamphlets, all type of information about Medicare. Here's a Medicare guide for 2026, and this is wonderful because it gives you so much information. And now I'm going to be taking this in steps because it's a lot. It is a lot to learn, and it's a lot for me to explain to you guys. We're going to start with the easy part. It's going to be as easy as ABC. Okay. Now, if you're collecting Social Security before the age of 65, if you took early retirement, or if you applied for disability and you received it, you are eligible for Medicare. So, if you are collecting your benefits when you turn 65, you should be enrolled in Original Medicare Part A and B. You will receive this Medicare card in the mail 3 months before your 65th birthday. My birthday is in May, so I have received this information here. If you don't sign up during your initial enrollment period, you can enroll during the Medicare Advantage enrollment period, January 1st through March 31st. So, what I'm understanding, there's a Medicare initial enrollment period. You have 3 months before you turn 65. You have the month of your birthday to enroll in this Medicare. And you have 3 months after your birthday to enroll in the initial enrollment. So I'm at that point now where I can go ahead and enroll in Medicare. And based off of the card they sent me, my coverage starts on May 1st. And my birthday is May 29th. And so it starts the first, I guess, of the month that your birthday is in. And now Part A helps pay for hospital stays and inpatient care. Part B helps pay for doctor visits and outpatient care. Now, in those two parts, you hear nothing about medication or prescription drugs, right? So there is a Medicare supplement insurance that you can apply for. And there's a Medicare Advantage plan. So after you enroll in the Original Medicare, A and B, A is free and B is something you pay for, from what I'm understanding. But I haven't called yet. I have not made that call to get another insurance to go with my Medicare A and B, because I definitely want prescription coverage and dental and hearing coverage. So I'm going to have to go into this spider web. I don't even know what to call it. It's so much information. And you have to have some type of idea of what you want, what you need, and be able to address the person you're talking to let them know what you want. Because if not, you may get something that you don't need. If you're someone who's pretty healthy and all that, you may just you know, you may just need A and B or something. I don't know. I'm so confused about this because we all need vision, dental, and prescriptions, right? So I don't know if that would come with Medicare supplement insurance or a Medicare Advantage plan. So I have not made my call yet to signify which of these plans I want, and so I don't know if I should ask them what they think or maybe they'll ask me, are you healthy? Do you take a lot of medications? And the thing about it though, at 65, you may be in great health and not need any of this stuff, and then later on when you're 70, 75, 80, your health may change. Well, it probably will change, but I'm just wondering, will you be able to change your health care at that time? Is there an open enrollment to get other health care added to your Part A and Part B after the fact, after you've already enrolled in it? Is there an enrollment period to change your plans? That's what I need to know. So all of this Medicare A, Medicare B, there's a lot to read up on and to have an understanding of what's going on. And I'm going to tell you, as a kid, I remember seeing this Part A and Part B in my mom's wallet. I remember seeing this card. This is one of those cards that, seeing it just takes me back to my parents. They both had that card when I was growing up. And I guess it worked for them. From what I can understand, they saw their doctor regularly, that I recall. And it seemed to have worked out well for them. But now I have to do this. I don't want to do it. But I'm going to do it because I'm going to need this stuff. Dang. This is a lot of research that I have to do. I guess I can do it. And you guys are going to come along with me because this is just Part A and B that we're talking about right now. And once I learn more about it, we're going to talk about that. Once I make my call to decide which insurance plan I've signed up for, I'll let you guys know that and how that went. But if you are a year or so away from 65, or if you'll be turning 65 in the next 6 months, I would say it's time to really look at all these things that are coming to your home, telling you it's time to consider saying yes to a Medicare plan. All right, you guys, so stay tuned. We will be doing more on this. I'll be telling you more about what I find out. And hopefully I can help somebody make a choice of what they're looking for in this Medicare maze. That's what we're going to call it. It's a maze. It's amazing. But no, seriously. We are going to get into this Medicare and figure out what the heck we have to do next. So if you haven't picked a plan yet, or if you want to know more about the Medicare maze, stay tuned because we'll be getting deep into this once I know exactly what I'm getting into. I just wanted you guys to be aware of this Medicare, and it may be simpler than I think, but right now I'm a little confused as far as what I need to do, what I want to do. I shouldn't say need to do. What I need to do is pick a plan. I have to call the number and pick a plan. So that will be my next video, talking about what I did, how I did it, and what I got. Make sure you like, comment, subscribe if you haven't subscribed to the channel, and hype this video up. And stay tuned for the next parts of this video. Bye.